We're ready. Thank you so much.
Okay,
Derek?
good evening, everyone. Welcome to the February 8th Human Services Commission of the City of West Hollywood meeting. I'd like to call the meeting to order. In an effort to protect public health and prevent the spread of COVID-19 coronavirus, AB 361 has authorized public meetings to take place via teleconference because state and local officials are recommending measures to promote social distancing. Please note that the Zoom platform is the official viewing platform for this meeting. To afford the public with an additional viewing option and in order to expand access to our public meetings, this meeting is also live streamed as a courtesy on YouTube, youtube.com/WehoTV. However, because YouTube is a third party and operates independently from the City of West Hollywood, the streaming reliability cannot be guaranteed. And can we have a call to order? I'm sorry. I'm sorry. I was looking at roll call. Can we have Mayor Meister give us the Pledge of Allegiance?
Absolutely. Hand over your heart. I pledge allegiance to the flag of the United
States of America
and to the
and to the
republic
republic
for which
for which it stands,
one
one
nation,
nation,
under God,
indivisible,
indivisible,
and
with
liberty and justice for all.
for all.
Thank you so much, Mayor. And now the installation of a new member.
I think I'm up again. Sam Borelli, are you ready?
Mom, I'm home.
Okay, raise that right hand and repeat after me. I, Sam Borelli, do solemnly swear
I, Sam Borelli, do solemnly swear
that while serving in the office
that while serving in the office
as a member of the Human Services Commission
as a member of the Human Services Commission
of the City of West Hollywood,
of the great city of West Hollywood,
that I will support and defend
that I will support and defend
the Constitution of the United States
the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California,
that I will bear true faith and allegiance
that I will bear true faith and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California,
that I take this obligation freely
that I take this obligation freely
without any mental reservation or purpose of evasion,
without any mental reservation or purpose of evasion,
and that I will well and faithfully
and that I will well and faithfully
discharge the duties upon which I am about to enter.
discharge the duties upon which I am about to enter.
Congratulations, Commissioner Borelli.
Thank you,
All
Mayor.
right.
Thank you.
Commissioner Burley, do you have anything to say?
Thank you, Mayor Meister. Really appreciate your confidence in me. I said earlier, Mom, I'm home. Look forward to working with you all. Let's get to work.
Great. Congratulations, Sam.
Thank you very much. Thanks, Lauren.
Jenny, can we get a roll call?
Of course. Commissioner Borelli,
Here.
Commissioner Byers,
Here.
Commissioner Darvish,
Then,
Commissioner Davis,
here,
Commissioner Freiberg,
Here.
Vice Chair Meltzer,
Here.
Chair Paul Mary.
Here.
We have a quorum. Thank you.
Thank you. We'll go to approval of the agenda,
So moved.
moved by Vice Chair Meltzer, second by Commissioner Davis. Can we get a roll call?
Of course. Commissioner Borelli,
Yes.
Commissioner Byers,
Yes.
Commissioner Darvish. I'm sorry.
yes,
Thank you. Commissioner Freiberg,
Aye.
Vice Chair Meltzer,
Yes.
Chair Paul Mary.
Yes, thank you.
I didn't get to vote.
E, approval of minutes.
I did not get to vote.
Commissioner Davis,
I did not get to vote in that vote. My
Okay,
name was not called.
Commissioner Davis?
Aye,
Thank
Thank
you. My apologies.
that's okay.
Sorry that I didn't see that, Stephen. Approval of minutes.
Make a motion to approve.
Okay. Second, please.
Second.
All right, moved by Commissioner Darvish, second by Vice Chair Meltzer. Thank you. Can we get a roll call?
Commissioner Borelli?
I will abstain.
Thank you. Commissioner Byers?
Yes.
Commissioner Darvish?
Yes.
Commissioner Davis?
Aye,
Commissioner Freiberg?
Aye.
Vice Chair Meltzer?
Yes.
Chair Palmieri?
Yes, thank you.
you.
We'll now move on to public comment. Jenny, I believe there's a few public commentors.
Correct. Our first public comment will be Diane Collin-Epstein, and you have 3 minutes.
Good evening, Chair Palmieri, Vice Chair Meltzer, Commissioners, staff, and public. I'm Diane Kahn-Epstein, and I'm a program administrator in the Strategic Initiatives Division. Lovely to see you all. And I'm here with Rachel Resnick from NCJW to share some information with you about the city's upcoming launch of our first guaranteed income pilot. I'd like to provide some quick highlights about the goals, funding, and partners involved in the pilot, and then turn it over to Rachel to share some details about the eligibility requirements and timeline. As you know, there are dozens of guaranteed income pilots throughout the country, providing an unconditional, no strings attached, monthly cash payment directly to a targeted group of people for a specific period of time. These payments provide an income floor to the participants, and a guaranteed income pilot is a way to test the impact of those cash payments. The city's pilot, which is the first LGBTQIA focused pilot and the first older adult focused pilot in the country, will provide $1,000 a month for 18 months to 25 older adults living on a low income. The pilot's population aligns with our city's history, current demographics, and the data, which indicates the vulnerability of this population. National data shows that LGBT older adults are less financially secure than their non-LGBT peers due to experiencing lifelong disparities and barriers to accessing programs that support aging adults. Reports from our social service agencies and from the city's 2019 community study also support this. The city is launching this pilot to evaluate guaranteed income as a way to prevent homelessness, support community members aging in place, and reduce the stressors of financial insecurity. Along with the quantitative data that will be collected, the narrative information that we gather will provide greater understanding into the unique income stability challenges that LGBTQIA older adult community members face. In order to launch this pilot, Strategic Initiative staff secured $450,000 for funding specifically for the participant distribution component of the pilot. That was $337,500 from Measure H innovation funds for homelessness prevention, and $112,500 from a private donor who's interested in guaranteed income, honoring her late partner and supporting LGBTQIA and older adult populations. The city has 2 administrative partners, the Center for Guaranteed Income Research at the University of Pennsylvania as the research and evaluation partner, and NCJW as the nonprofit administrator implementing the pilot. As you all know, NCJW has been a valued contracted partner for decades and has been vital, vital implementing the city's rental assistance program, especially during COVID. So what you may not know is NCJW also developed and has been implementing a local GI pilot for caregivers as well. Now I'm going to turn it over to Rachel, but also want to let you know that you can learn more about the details of the pilot by visiting weho.org and checking out the projects in the pipeline section on the strategic initiatives page. Thank you. Nice seeing you.
Thank you, Diane.
Rachel Resnick, you have 3 minutes, and I will start the timer now. Thank you so much. You're muted. Let's start over. 1 second.
Thank you,
All right.
Jenny, for your grace.
You're all set.
Okay. Greetings, commissioners. It has been a while since I've seen many of you, and it is good to be back with all of you. We are honored to be the city's nonprofit program administrator for the pilot for guaranteed income. In addition to our longstanding partnership with the city to provide direct services to community members, we have spent much of the past 2 years expanding and administering rental assistance to city residents during the COVID-19 pandemic. In many ways, rental assistance is a precursor or programmatic cousin to guaranteed income. We are also halfway through a guaranteed income pilot for female caregivers and healthcare workers living in LA City Council District 13. I want to quickly walk you through the next few weeks for PGI in West Hollywood. We have finalized our application with input from city staff and our research partners and are currently translating the application into both Russian and Spanish. The application will be available online, accessible on both web and mobile. It is a short 12 questions and will give us the information needed to determine pilot eligibility for applicants. The qualifications for eligibility include number 1, being 50 years or older as of April 1st. Number 2, living in West Hollywood, either housed or unhoused. Number 3, identifying as a member of the LGBTQIA community. And number 4, living at or below 50% of area median income for the LA metro area. 50% is $41,400 for a household of 1. People are eligible for this program regardless of citizenship status. Our outreach is underway, our flyer is ready for citywide distribution, and our website will be fully operational before the end of this week. We have 2 information sessions for community partners next week to prepare city contracted agencies and service providers to assist their clients in applying for PGI. Applications will open on Friday, February 25th and stay open until Sunday, March 6th. The week of March 7th, 25 participants will be randomly selected by researchers with Penn Center for Guaranteed Income Research. Our staff will verify that the selected participants meet eligibility requirements based on requested documentation, and each participant will have the opportunity to undergo benefits counseling in partnership with APLA to make sure that their benefits are protected, and so that each participant can make the best decision for themselves about participating. Once selected participants agree to enroll, they will be onboarded with our distribution partner to be able to receive the monthly funds of $1,000 per month from April 2022 until September 2023. The first payment is scheduled to be distributed to participants on April 15th. We will gladly return to update you throughout the pilot process and welcome you to be in touch with me with any questions about the program.
Thank you, Rachel.
9 seconds to spare. Our next public comment will be Karen Ayers. Let me ask you to go on camera and mute yourself. And your timer is starting now. Thank you.
Thank you. Good evening, commissioners. It's great to see housing insecurities addressed at this meeting, and I was happy also to see Bet Zedek on your agenda for presentations. I am a resident of West Hollywood, and I'm also serving on the Rent Stabilization Commission. And I just wanted to let you and people tuning in know that the rental assistance is available. The County of Los Angeles eviction moratorium extension has been, the moratorium has been extended, and it applies to West Hollywood residential tenants through the end of this year, 2022. Tenants will be protected from most no-fault evictions through the end of this year, so long as tenants are complying with the law's requirements. There's lots more information about this on the city's website under renter resources. And let's see, there is also just a lot of resources listed there for tenants who need assistance, including Bet Zedek and Coalition for Economic Survival and Stay Housed LA. And there's just plenty of resources there for our residents of West Hollywood to tap into. Just wanted to put that out there, and I just want to close with saying hello, Borelli. I'm so glad to see you back where you belong. Have a good evening.
Thank you, Karen.
Jenny,
any
Karen.
more?
Yes, sir. Our next speaker will be Patrick. His last name is Blood. He's with the Disabilities Advisory Board. Let me ask him to go on camera. There you are. You have 3 minutes.
Good evening, Chair, Vice Chair, Commissioners, and of course, City staff. My name is Patrick Blood, a resident of the City of West Hollywood and the Chair of the Disabilities Advisory Board. I just wanted to join you quickly tonight to let you know that the DAB has done liaison assignments, and board members Yola Dore and alternative liaison board member Mikey Friedman have graciously agreed to be DAB's liaison with your commission. I sadly do not believe either were able to attend tonight, so I'm attending this evening so I can keep the DAB abreast of everything that that you are doing. As a member of the disability community, and speaking for myself here, I often feel unseen, unheard, or treated like a burden, not an asset to the larger community. Within your purview are matters which affect persons living with disabilities, some of which, of course, are not visible to the eye. I urge you to keep residents and visitors of West Hollywood who are living with a disability in mind as you discuss each item, as to make our community not overlooked. I have often heard myself, whether on a local, state, whatever level, or during business meetings, that folks did not think about something that an issue that affects the disability community. So instead of being overlooked and thought as an afterthought, I urge you to keep that on the forefront of your mind. I'm thrilled to see former DAB member Joy Freiberg is on your commission. She's always been nothing short of incredible and sensational, and I know she's serving this commission tremendously. So to Joy, you are such a gem, and keep doing the amazing work you're doing. I adore you. So I'm looking forward to your meeting this evening and wishing you a successful and productive year ahead. Thank you.
Thank you, Patrick. Jenny, anybody else?
At this time, we don't have any additional public comments.
Great. Can I get a motion to approve the consent calendar?
I believe we approved consent calendar under the agenda.
Automatic? Okay, sounds great. All right, unfinished business, HIV Zero Initiative 5 Evaluation Report, Year 5. I'm going to hand this to Derek, and then I guess he will hand it over to Dr. Celius.
Good evening, commissioners and members of the public. So yes, I'm going to do a little bit of an intro and then hand it over to Dr. Celius to do the full presentation. So since the early days of the HIV epidemic, the city of West Hollywood has been one of the most impacted cities in Los Angeles County, and also one of the most responsive cities. This city established a social services division in 1985 to provide services to community members, especially those who've been affected by HIV and AIDS. And we continue to invest heavily today in prevention and care services. In 2015, council members D'Amico and Duran directed staff to develop a plan and work with social service providers, local doctors, boards and commissions, and other government agencies to reduce the rate of infection and slow disease progression so that West Hollywood can become a zero transmission city. The following year, the HIV Zero Initiative was launched, and we contracted with the Maroon Society to evaluate our response and our portfolio of services to ensure that the city and all of our contracted and collaborative partners are really in sync with the goals of the initiative. There's been a lot of activity in the past 6 years, and Dr. Celius will go into detail of our accomplishments. But I do want to put this presentation in context because a lot of both good and bad has happened since 2015. There's been an expansion of biomedical interventions such as PrEP, the adoption of U=U messaging by the National Institutes of Health and the Centers for Disease Control, the expansion of syringe exchange programs, injectable medicine, and new and exciting clinical trials involving the mRNA vaccine and HIV. But there's also been setbacks such as COVID and its impact on health, mental health, and substance use among people living with or at risk of HIV. And we've also seen how COVID impacted community clinics with reduced HIV and STD screening during an STD crisis in the county. So Dr. Celius in this discussion will talk about the progress that's been made with the HIV Zero Initiative and some of the lingering challenges that still exist. So at the end, we'll welcome all your feedback at the end of this presentation. So I'm handing this over now to Dr. Celius, and he has a PowerPoint too.
Thank you, Derek.
Thank you, Derek. Let me get this going. All right. So I know that our time is limited, so I will be as brief as possible, as well as being comprehensive. It has been a pleasure on behalf of Maroon Society to work with the City of West Hollywood and the Social Services Division, all the social services agencies contracted throughout the HIV Zero Initiative, and to receive feedback ongoing and support from the Human Services Commission. So I'd like to start with that. I'm going to be joined tonight by my colleague, Patricia Ortega, who has been working on the HIV Zero Initiative throughout the initiative, mostly in the background, but tonight she's going to share in the presentation. So for those of you for whom the HIV Zero Initiative may be new, the initiative started with some really bold goals. And I'd like to say that the City of West Hollywood has always taken leadership positions when it comes to advocating for communities that are often marginalized, including the LGBT community, disability community, people living with HIV, and those at an elevated risk. And so with that, the vision for the initiative started with the bold goal that the city would be a place where people living with HIV have easy access to comprehensive healthcare and social support services, and become a city, or be a city, maintain their status where no members of the community have an elevated risk for acquiring HIV or encounter discrimination based on HIV status, sexual orientation, or gender identity. And so based on those goals, we helped craft the evaluation metrics that we used over the past 5 years that I'm going to talk about tonight. The 4 broad goals of the initiative were to increase health insurance and coverage access for those that are disproportionately impacted by HIV, reduce HIV infections and diagnoses, reduce HIV-related disparities, as well as reduce the progression of HIV to stage 3 or AIDS diagnoses. And at this point, I'm going to turn it over to Patricia to talk a little bit about the methods.
Hi, I would like to start by saying it is an honor to be here, presenting in front of all of you. I would like to also say that none of this would have been possible without the hard work and dedication of the social service agencies. So thank you so much. Right now, I'm going to talk a little bit about the methods we use to evaluate the HIV Zero Initiative. First, the evaluation took place between the fiscal year 2016, 2017 to 2020, 2021. The first piece of data that we analyzed was program data from all contracted agencies biannually. These agencies you see listed are the agencies that provided social services. I would like to, this would be a good time for you to snap your fingers or applaud these agencies for all their hard work. They were really helpful in our study. The second major set of data that we analyzed was HIV surveillance data. And the last pillar of the evaluation included biannually survey on stigma. We conducted 9 waves and surveyed 2,389 people in the city of West Hollywood. Now I'm going to turn back to Aaron to continue the presentation.
Thank you. Patricia has been working on the data since the beginning. And as you can see, if you can see the photo, that's her actually on the front lines doing surveys. She probably conducted over 500 of those 2,389 surveys herself. You can see that we are at the Sizzle area during one of the annual Pride events, which made it very convenient and easier for conducting those surveys. I also like to just briefly say that in the data that we're about to share, it includes the HIV surveillance data shared by the Department of Public Health, as well as the Ryan White data. I know for many of you who have been on the commission since the beginning, the Ryan White data is new. This was something that we wanted to look at before the evaluation was done. Ryan White, just to put everyone on the same page, Ryan White is the federal funding source. It's the payer of last resort, and we believe that many of the clients that are served by the social services agencies may be qualified for Ryan White. So we felt that it would be helpful to look at that data alongside the data that's shared by the county throughout the evaluation period, just to see if there are any differences. So with that, I'm going to start and talk about goal one. So the first goal was to increase healthcare access for men 18 to 44 years old. The reason that this population was targeted is because at the beginning of the HIV Zero initiative, this is the group that was the least likely to have access to healthcare, least likely to have health insurance, and the most likely to acquire HIV or be living with HIV. And so we know that when people have access to healthcare, they're less likely to either transmit HIV if they're living with HIV or acquire HIV, just based on the fact that they have access to healthcare resources like ART, antiretroviral therapy, and pre-exposure prophylaxis. And so I didn't really speak to that one, but that first goal, we set the goal in the 80s, and as you see, that goal was far surpassed throughout the evaluation period. The second goal was to reduce annual HIV diagnoses. As you can see, the diagnoses have gone down since the beginning of the evaluation. We would like to see it go down more. As you can see, between 2016 and 2019, it's been relatively flat. There was, in 2018, we saw a dip and we got excited, but then it went back to 45. For those of you who are new to this, I'm just going to share. HIV surveillance data has a 1.5 or 18-month lag in which they can share it, and that's set by the CDC. And so it always makes it a challenge evaluating how well activities impact HIV surveillance data, because we're always a 1.5 behind. But with this, we did see an overall drop from 2015 to 2019. However, it does appear that it has it plateaued. For goal 3, linkage to care, it's gone down. There's no other way to say it. We would like to see linkage to care go up. Linkage to care is within 30 days, someone is diagnosed. The goal is to have 85% or above linkage to care. If someone is not linked to a HIV provider within that 30-day period, it does not count as a link. But as we see, as I've mentioned before, when we look at Ryan White clients during the same period of time, their linkage rate is 95%. And we believe that that is more representative of the social services agencies with whom we've been working over the past 5 years. The second metric that we're looking at is retention in care. Retention in care, again, just like linkage, went down. What this graphic is showing is the white line includes retained in care, and that's the metric that's used nationwide as well as at the county level to measure people's how well they're doing in terms of the cascade of HIV retention, linkage, retention, and viral suppression. And we see it went from 58% to 48%. So to be retained in care, a person living with HIV needs to have 2 doctor visits where they're getting their viral load tested, separated by 3 months within a 12-month period. And we see that it went from 58% to 48% during that same period. When we look at engagement, it's better. It's 74. It went from 74% in 2015 to 70%. So that also went down. But engagement just means 1 test. But again, if we look at Ryan White clients, their engagement and their retention is much higher. Their engagement is 61% versus 48% during the same period of time, and their engagement is at 85%. So As we move forward with measuring HIV surveillance data, these are things to keep an eye out on. Viral suppression during the same period has gone down, although this line looks like it's gone down a lot. It really hasn't. 69 to 63% is really just slightly above the margin of error in most statistics, but it has gone down. And we believe it's gone down mostly because of that previous slide, because people living with HIV, there are two reasons. One, people living with HIV who are getting tested, they're more likely to be virally suppressed, which we believe is resulting in them not going to get doctor visits as frequently, as well as the fact that there is, they're not going in as frequently, mostly because of better health outcomes. That's sort of what we're hypothesizing. If we look at Ryan White clients, we see that their viral suppression rates are at 79%. And part of this data is compromised by the fact that in the city and the county and everywhere, really, the only people that have to report HIV surveillance data are those that have contracts with the government to report. And so private providers have no mandate to report. So we're missing a large number of clients for whom we could analyze the data to really understand, is viral suppression going down? Is it staying flat, or has it gone up?
And Dr. Celius, I'm sorry, can I just clarify one thing? So
Yes.
when we say surveillance data, we're not talking about diagnoses, because diagnoses have to be reported to public health. So we're talking about linkage or retention of viral suppression. Sorry about that, Dr. Celius.
Thank you for the clarification. Absolutely. So that's what we're looking at. And so it's over the past 7 years, it's that cascade from linkage to retention to viral suppression that was considered the gold standard that everyone was measured against for how well we're doing in terms of providing support services and driving down the epidemic. The next slide, we start talking about reducing disparity. So at the beginning of the evaluation, back in 2015, we created the goal to say, so nationwide, there was a goal to reduce disparity, and disparity was defined nationwide by saying, we want to have a future where no group of people has a disproportionate impact by HIV, meaning that there's no group for whom HIV is linked to. For years, it has been MSM, gay and bisexual men, who have had the highest disease burden. And so when we looked at the city of West Hollywood, we said, if we're looking at reducing disparity, one of the strong indicators, and not just the research team, the community said this as well, is looking at young MSM. That's the group that are driving the epidemic. And if we see a reduction by X% among this group, we will know that we're driving down disparity. And as we can see, among young MSM at the beginning, diagnoses were at 41. By 2019, that number has gone down to 19. And so this is one of the big achievements of the HIV Zero Initiative, to drive down that disparity. The red line represents all males in the city. And just for those that may be new to this, 99% of the people living with HIV are men, as well as 99% of new diagnoses are among males. That's why in all of these, we haven't reported on HIV among females, not because we're trying to not include them, it's because the county doesn't provide that data because the numbers are so small, it would potentially compromise their anonymity. The fourth goal was to reduce AIDS diagnoses. And as you can see from this chart, the city has done a fantastic job. It was at 24 in 2015. As of 2019, 8 new diagnoses. And so that is 300% drop over the period of time. So that's one of the other major successes. When we looked at what we're really talking about is in the evaluation is what's the quality of life we're now in a place where people are no longer dying at the same rate as they were. There are HIV-related or AIDS-related deaths, but the numbers are way down, which is a testament to the work and the coordinated effort of both the city and the contracted agencies. In addition to driving down disparity, I want to talk a little bit about the stigma, the surveillance stigma that we tracked, as Patricia had mentioned, over 9 waves over the past 5 years. And this, we're looking at wave 3 versus wave 9. And the reason we're looking at wave 3 versus wave 1 is because the surveillance stigma evolved throughout the period of time, where we refined some of the questions to find out what really makes sense for the community, and what metrics really work that we'd stick with. And so this first metric was about comfort talking to the doctor about one's sex life. In the earlier days of the epidemic, people would be, fearful of the stigma related to talking about the type of sex that they're having with their provider. And so we thought that by demonstrating people's comfort speaking to the doctor, the likelihood of getting the right type of treatment and care goes up. And we had the hypothesis going into this that stigma was really high when it came to medical settings, and we were wrong. As you can see, at wave 3, 87% said that they were usually or always comfortable speaking with their doctor about their sex life. It went from 87% among those who are living with HIV to 89% by wave 3. So not a tremendous increase, but an increase nonetheless. Among HIV negative community members, that comfort level went down. That could be as a result of a variety of things, but that's what we found. In terms of stigma, also, we know that asking a new sex partner about their status was an issue that we thought made a lot of sense. As we see among HIV positive community members, that comfort went up from 71 in wave 3 to 79 in wave 9, the most recent wave. For those who are negative, that went down. The comfort level went down from 83 to 72. Not really sure why, but that would be something to look at in the future. And the last one was comfort revealing one's HIV status. And this is another one of the, in my opinion, big victories of the overall look at stigma. For those living with HIV, comfort revealing one's status went from 79% at the very early days of this evaluation to 92%, which is, it's not 100%, but it's in the 90s, and that's pretty fantastic. Whereas those who are negative, 95% to 100%, which is also very good. And then in terms of experiencing HIV-related stigma, that report went down as well from 34% in wave 3 to 24% in wave 9. Just to be clear, HIV-related stigma is more of an internal process about how people internalize their HIV status, whereas discrimination is external, where it's being discriminated by others. And so just to clarify that piece. This is one of the more interesting findings of these surveys. This graphic looks at fear in both transmitting, acquiring, and getting COVID-19. So as we can see, the fear of getting COVID-19 as of last year was much higher than either transmitting HIV or acquiring HIV. And so that really represents where we have come in the HIV epidemic, even over the last 5 years. And I want to talk a little bit about the accomplishments, and this is wrapping it up. I know the time is of the essence. So one of the big accomplishments is increased healthcare coverage among men at the greatest risk of HIV, reducing HIV diagnoses among the same group of men, a decline in stage 3 or AIDS diagnoses, a decrease in HIV-related deaths, and a reduction of HIV-related disparity and stigma. And with that, I'm going to turn it over to Derek to discuss what the next steps are in the future of the initiative.
Okay, thank you, Dr. Celius. So as we begin to sunset this HIV Zero initiative, we're at a good place, but also at a place where we need greater collaboration among the county, the state, and the federal government. The Biden administration launched their National HIV/AIDS Strategy 2022 to 2025 last year with the goal of reducing new diagnoses by 75% by 2025 and 90% by 2030. LA County also released their Ending the HIV Epidemic Plan, which is in alignment with the Biden administration's goals, which focus on 4 key pillars, which are to diagnose people living with HIV as early as possible, to treat people rapidly and effectively to achieve viral suppression, to prevent new HIV transmissions, and then also to respond quickly to HIV outbreaks and deliver prevention and treatment services to anybody who needs it. So in mid-2021, the federal government directed, and that's HRSA, directed all impacted counties and their planning bodies to combine all these local efforts, so these local city efforts, into one regional effort. And to accomplish this goal, the Los Angeles County Commission on HIV is currently working on a comprehensive Ending the Epidemic Plan, and all 4 impacted cities who sit on the commission, West Hollywood, Los Angeles, Long Beach, and Pasadena, are contributing to this effort. We're in discussion with commission staff and consultants on ways we can incorporate our plan into this regional plan. So as you can see here, we do have similar aspects such as reducing, but we have similar aspects, but then also we have, West Hollywood has some different and interesting things like surveying stigma and also reducing health inequities and expanding healthcare access. So these are all things that we're going to advocate to include into this one regional plan for the county. And collaboration will be key in ending the epidemic. I can provide an example of how we collaborated for a greater impact in this community and in this region, the SPA4 region. So in 2021, the county identified a cluster of new HIV infections in West Hollywood among injection drug users, some of whom were unhoused. The county set up a meeting with the city, and we invited our trusted partner, Being Alive, to discuss the issue. The outcome of this meeting was that Being Alive received increased funding and increased capacity to provide weekly syringe exchanges in West Hollywood instead of bi-weekly. And also they provided more funding for Being Alive to increase their harm reduction supplies, such as their safer smoking supplies. So we can expect to see more of these examples under a regional effort. So in the years ahead, staff will recommend that the city consolidate its resources to align with the County of Los Angeles's Ending the HIV Epidemic Plan. So this concludes the presentation, and we're all open to any questions or comments that you have.
Thanks, Derek. Thanks, Dr. Celius. Thanks, Patricia. I'm going to go around with the commissioners and see if anyone has any questions. I will start with Commissioner Davis.
No, thank you. I'm fine.
Great. Commissioner Byers. Commissioner Freiberg.
I don't have any questions, but thank you for your presentation.
Commissioner Darvish.
Yeah, a great job, Dr. Celius and Patricia, both, and Derek. I just had a quick question about related to cost of medication. That obviously wasn't part of your study, and how, if that had any effect in the pattern that you had seen, if there were any areas that needed to be improved. I know that you mentioned sort of compliance was one that, I forget, one area that over time dropped for the 2 tests or every 3 months or whatever the period was, but just the medication was one in my mind. I know it's very expensive, has been very expensive. If there's any kind of light at the end of the tunnel for that population, and also I guess I would look at it as any kind of non-compliant, patient or population. mainly related to all the modalities that have been available, and they're not afraid of catching, being HIV positive anymore. Maybe that's maybe one reason, but just wanted to get your insight on why you see that non-compliant population that don't want to go get tested twice, and then the cost of medication, if that has any effect on improving, getting rid of this, this pandemic.
Sure. Yeah, thank you for the questions. So in terms of costs, just to address that question, I don't believe that cost of medication is a barrier to receiving and staying adherent to a medical regime. I had mentioned in the presentation that Ryan White funding provides medication for those who do not have adequate insurance. They're the payer of the last resort. So it's typically not finance that's making people perhaps non-adherent. We can't say that people are not adherent based on the data available. What we can say is that the base that's used to determine viral suppression is incomplete. And it's incomplete because, as Derek had mentioned, private providers don't need to report all the tests that they're doing with their clients. And so there are about 1,000 people, there are about 2,300 more or less people living with HIV in the city. Only about 1,000 are Ryan White recipients. And so that means that there's possibly another 1,300 for whom we're not getting any data reported. And so we don't know that people are not being adherent. We just know that the base is 2,300. Does that answer the question? Okay.
Commissioner Borelli?
Thank you, Mr. Chair. Thanks for not making me go first with me being new and all. Thank you, Patricia, Dr. Celius. Always a great report. You know this commission loves data, and data is really important to us, so thank you. The question is related to what Commissioner Darvish was just talking about, the private care. That really stuck in my head that we're not able to collect that data. Is there any possibility or future with the county of being able to capture that data in the future?
I'm unaware of any mandate that would require that. Derek may have more insight than I do.
It's my understanding that it can't be done without legislation.
Yeah.
Great. That's my only question. Thank you very much.
Okay.
Vice Chair Meltzer?
Hi, yes, thank you. Congratulations on all the successes that you've had, and we've heard these reports for a lot of years, but I do have one question, and it's probably the same thing. But there are a couple of things that were said: the condom fatigue, a waning concern, and the use of condoms to avoid acquiring is going down. Is there anything we can do to help that, to change that?
I don't think so.
Okay.
That's my opinion. But from a more scientific approach, possibly. I think the thing is that what we know is that the campaign for U equals U has been so strong and so effective that if people who were once at higher risk don't believe that they're at risk for HIV, there is both in terms of sensation and other things that are going to stand in the way of using a condom. If people were previously using condoms to avoid getting HIV, and there's not a risk of HIV because if someone is virally suppressed, they really can't transmit HIV. And if someone is not positive and they're taking PrEP, it's almost impossible to get HIV. So I'm not sure what world.
Okay, I just wanted to know if there was anything, but thank you, Dr. Celius and Patricia, so much.
David, did you have something to say?
Yeah, I think I just want to, to Commissioner Meltzer's point, is there anything that we can do? I do want to reiterate that we continue to fund programs that provide condoms. As you know, we have the WeHo Life condom distribution program. And I think it's also important to tie in the prevention of spreading STDs and STIs and how condoms assist with that. So I don't know if I would agree that we can't do anything about it. I think that we're consistent with that messaging that it is still important to use a condom. And yes, the medications are really effective for preventing the transmission of HIV, but there are other things. And as we know, during this pandemic, we had a significant increase in syphilis cases. So we're still out there, we're still, with your support, we're still contracting for organizations that continue to do the condom distribution programs and get that message out. It's more than, you're protecting your partner from more than just HIV with a condom.
And I just wanted to add just two things to that too, which is, of course, increased testing. So testing is so important. And then also making sure that those condoms are accessible and free, and which is what WehoLife does and has a variety of different choices, whether that is extra large or insertive condoms or other types of sizes available. It just makes it more accessible for the population.
Okay, I guess it's my turn, and I just want to thank you, Patricia, for coming in and assisting Dr. Celius with this. And Dr. Celius, it's really, truly a pleasure to see you all the time. And congratulations on the successes that we have had. And, there's always room for us to do more work to assist in these, but I'm really impressed, and I've loved watching this as it were. I do have a question for David or Derek, and I don't know if you have the answer, but what is the amount of condoms that we distribute a year? Is it 200,000, 250,000? What are we?
That's a Derek question.
It is a question, and I'd have to get back to you because I'll look at the program report at the Q4, and I can tell you what we distributed last year.
Okay, thanks. It was just actually, it was a rhetorical question. I wanted the new commissioners to understand that we do distribute a significant amount of condoms. All right.
It's about $250,000 around there. So yes.
Yeah, that's what I thought. Okay. Thank you, Dr. Celius, very much.
Thank you. Thank you, everyone. It's been a pleasure.
Okay. Board and commission liaisons. So I think the easiest way to do this without everybody screaming over each other is, right now, there are some liaisons in place and, hello? Okay. So this limits my visibility. So
I think turn it off, Jimmy, and let me know when you're ready for it.
Okay. So I have that in front of me. I don't know if all of you do. It was in your packet. Maybe you do. Oh, great. If you have it, could you just raise your hand so maybe we don't have to put it on the screen? Commissioner Byers, do you have it?
Do I have
the liaison list?
No, not in front of, I have it on my screen.
Okay, so is it available to you?
Yes.
Okay, great. So maybe we can just, I'll go down the list. There are some liaisons there that are already in place, and we'll see if they want to remain or if someone else wants to possibly join on that. And we'll just try to do it as humanly as possible. So Planning Commission, right now, the liaison is Commissioner Darvish. And is there anyone else that had an interest in that? Commissioner Darvish, did you want to keep that?
Yes, I can keep that, yes.
Okay, is there anyone interested in being an alternate in case Commissioner Darvish can't make it? Okay, so Commissioner Borelli, that is? I'm teasing. Okay, so we'll leave that open, and if anybody does want to do that, please just let staff know. Public Facilities Commission is next, and Commissioner Davis is on that liaison for that commission. Is there anyone else that had an interest in that? Is there anyone that might want to be an alternate? Commissioner Borelli? Great. Public Safety Commission, we have Commissioner Byers. Is there anyone else that had an interest in Public Safety Commission?
I think I was the backup. Maybe.
Oh, you are. I'm sorry, you are.
Oh, that's okay.
Yeah. So Commissioner Byers, do you want to stay with Public Safety?
Happy to.
Is there anyone else that would like to be an alternate for that? Currently, it's Commissioner Darvish. Commissioner Darvish, would you like to stay? Commissioner Freiberg?
I mean, I would be an alternate, but if Commissioner Jarvis wants to stay on,
It would be totally fine, and I would just dial in to make public comments. So I'll actually be okay with that. I think the more of us are involved, and rotation is healthy, so it's totally fine.
Okay, so staff has that. That's the only change so far, and that's Public Safety Commission. The liaison will be Commissioner Byers, and the alternate will be Commissioner Freiberg. Okay. Rent Stabilization Commission, there is no one at this moment. Is there anyone that would like that? All right, I will take that one since no one wants it. Is there anyone that might want to be an alternate just in case? Sam, I am not going to keep saying this.
I think Commissioner Borelli wants it. I think I saw him raise his hand.
Okay, well, we'll leave that open for now. If anybody does want to do that, please let me know.
Keep
Vice Chair Meltzer?
Do we really absolutely have to have alternates?
I mean, it seems that it has come up in the past. I don't know, staff would have to give me that answer, but it seems that we have had some alternates on some commissions and boards and not on others. So, I don't know. Staff, is there some legal thing that we have to follow?
Not a requirement.
Okay, so we'll just go down the list and I'll just call it out as it is. If we don't have an alternate, we don't have an alternate, okay? So I'll take rent stabilization. Transportation, we have as liaison Commissioner Darvish and alternate Commissioner Freiberg. Is there anyone that is interested in being the liaison to transportation? Commissioner Darvish, can I ask you if you want to remain on there?
Yes, very much so, yes.
Commissioner Freiberg, did you want to remain as an alternate?
Yes, please.
Okay, that's great. Disabilities Advisory Board, we have Commissioner Freiberg as the liaison, and there is no alternate at this point. Commissioner Freiberg, I want to ask you first, did you want to remain on that?
Yes, please.
Okay, is there anyone else that is interested in Disabilities Advisory Board? Is there anyone that might want to be the alternate for the Disabilities Advisory Board? Commissioner Borelli? And this is real this time. Great. Lesbian and Gay Advisory Board is completely open. It was Commissioner Shandrick, and now it's open. Is there anyone that has an interest in being the liaison to LGAB? Commissioner Borelli?
Yes, sir.
Okay.
I figure I'm filling Patrick's term, so I'll fill Patrick's shoes there too.
And I will be the alternate on that, unless there is, I'm sorry, is there anyone that wants to be the alternate on that? All right, I'll be the alternate on that, Commissioner Borelli. The Russian Advisory Board, there is currently not a liaison to the Russian Advisory Board. Is there anyone that has an inclination to be the liaison to the Russian Advisory Board? It doesn't have a liaison or an alternate. Anyone? Okay, we can come back to that at another time. The Senior Advisory Board, currently Vice Chair Meltzer is the liaison and Commissioner Davis is the alternate. Is there anyone that has an interest in a Senior Advisory Board?
I do.
So Commissioner Meltzer, would you like to stay on as liaison? Okay.
Yes.
Commissioner Davis, would you like to stay on as the alternate?
Yes, sir.
All right.
I would if the name changes. But
the what?
I said I would if the name changes to older adults or a more appropriate name.
All right, be that as it may. Transgender Advisory Board is Currently, it is me. I do not want that any longer. Is there someone that is interested in being the lead? And also the alternate was Commissioner Shandrick. So it's completely open at this point. Is there anyone that has an interest in being the liaison to the Transgender Advisory Board? Anyone? Okay, we can come back to that at another time. The WAB, or the Women's Advisory Board, currently Commissioner Byers is the liaison and Vice Chair Meltzer is the alternate. Is there anyone that is interested in the Women's Advisory Board or interested in being liaison? I'm sorry. Commissioner Byers, would you like to remain as the liaison?
Yeah, I'm happy to.
And Vice Chair Meltzer, would you like to remain as the alternate?
Yes, please.
Okay, great. The last one is Arts and Cultural Affairs. And I have as the liaison Commissioner Byers, and I don't have an alternate. Is there anyone that has an interest in Arts and Cultural Affairs?
I'll do the alternate, if that's all right.
You can do the other one if you want.
Stephen, did you want to be the liaison?
No, I just want to be the alternate.
Okay.
Okay.
You can always call me, talk to me.
Great.
Okay, Commissioner Byers, did you want to give that up? You don't need to be pressured to take any of these. If someone
No,
else
it's
wants
fine. Just
All
wanted to make sure Commissioner Davis knew.
Okay, so I guess I'm just going to refer to staff right now that you have Commissioner Davis.
I'll volunteer to be the alternate to the Lesbian and Gay Advisory Board as well.
No, that's me.
Is that you? Oh, I'm sorry. I didn't write you down. Never mind.
Do you want it?
No, if you're doing it, that's fine, sir. I didn't write it down.
Okay. So staff, would you like me to go over what I have to compare it to what you have? Okay, for Planning Commission, we have a liaison of Commissioner Darvish. There is no alternate. Public Facilities Commission, we have Commissioner Davis as a liaison. There is no alternate. Public Safety Commission, we have Commissioner Byers and Commissioner Freiberg is the alternate. And by the way, if I make a mistake, just say it, please. Rent Stabilization is me, and there is no alternate. Transportation Commission is Commissioner Darvish with the alternate being Commissioner Freiberg. Disabilities Advisory Board, the liaison is Commissioner Freiberg and the alternate is Commissioner Borelli. Lesbian Gay Advisory Board, the liaison is Commissioner Borelli and I will be the alternate. Russian Advisory Board is open. Senior Advisory Board, Vice Chair Meltzer is the liaison and Commissioner Davis is the alternate. Transgender Advisory Board is open.
I'd take it, Jimmy.
Okay,
I'll do it.
thank you. So we have Commissioner Davis as the liaison to Transgender Advisory Board with no alternate. Is there anyone else that is interested in that? Okay. Women's Advisory Board, I have Commissioner Byers as the liaison and Vice Chair Meltzer as the alternate. Arts and Cultural Affairs, I have Commissioner Byers as the liaison and Commissioner Davis as the alternate. Do I match up with what staff has? Did all the commissioners hear what they are a part of at this point? Great, so that was easy.
I do have a question, Chair, if I may.
Yeah.
Since most of these meetings are like ours as a Zoom meeting, I need the links to be sent to me. And I do get them for the Senior Advisory Board, but I don't get them for any of my other, what am I trying to think of? Any of my other responsibilities.
So is this a question for Jenny or is this a question for David or Leslie or Derek?
I think it's a question for Jenny and I. Jenny is great about sending out links to the liaisons that we're aware of. As we know, Yola Dore for the DAB. Jenny, can we send out this list to the staff liaisons from the other boards and commissions and ask the same?
I'm not sure how the other secretaries work and what their protocol is. We could always go on the city's calendar and find the link information. I will put it on my radar, Commissioner Davis, and keep you on track.
Thank you so much for that. All right, so that went by fairly easy without a headache. We have 4A would be new business, eviction, defense, and prevention program. And believe Derek will begin this and then it will be handed over to Rachel.
Yes, I'm going to just do a brief intro. So we have two programs with Bethzetic, the West Hollywood Project and the Eviction Defense and Prevention Program, which was brought on in July of 2020 to provide an additional attorney to provide full-scale representation to any tenant who needs it in the city. So even though there was an eviction moratorium at this time, it did not prevent landlords from trying all these different ways to try to evict their tenants. So this program has been incredibly successful since it started in 2020. It's been such a great success, and 204 people have accessed the program so far. So I'd like to introduce Rachel Levy, who is the attorney on the project, who can provide a bit detail about the program.
Hi, everyone. My dog picked the worst time to want to go out, so if she barks, I'm so sorry. Okay, so yeah, we've been busy at Bethzetic, as Derek just said. I just want to talk a little bit about the changes that we've seen in the last few months. A few months ago, we gave a presentation to the Rent Stabilization Commission, and we talked about trends that we were seeing. I think it was in September or October, and I just want to talk briefly about how things have changed in terms of the clients that are reaching out to us and the issues that we're seeing. So I would say that the biggest change we've seen in the last couple of months are more cases based on non-payment of rent, either tenants receiving 3-day notices to pay rent or quit, or tenants who have been served with eviction cases based on non-payment of rent. And the change is due to the changes in the state law regarding non-payment of rent. So just very briefly, on October 1st, the protections that were in place, I want to say enhanced protections that were in place between March 2020 and September 2021 changed. And the current protections that went into effect October 1 are now in place through March 2022. And these protections are all about the state rental assistance program. And basically, if a tenant applies for rental assistance and communicates that to their landlord, the landlord is not supposed to get a summons issued. And a summons is one of the two documents that starts an eviction case. So even though these protections are in place, we're still seeing an increase in non-payment of rent case. And it's either because the tenant is not communicating to their landlord that they have submitted a rental assistance application, or the summons are being erroneously issued. The good news is that if we get an eviction case where the landlord has a pending rental assistance application, because the landlord is required to apply for rental assistance before filing a non-payment of rent case. And if that rental assistance application has not been denied, the plaintiff, the landlord, will not be able to get a judgment in this case. So even though some of these cases are starting erroneously, there's a way to sort of halt them. In addition to that, we're still seeing a lot of unlawful detainer cases based on violations of a lease agreement or based on nuisance. But before, where we were getting virtually no non-payment of rent cases, because the law has changed, we are now seeing an uptick in those cases. We're also seeing that, under the state rental assistance program, housing is key. A tenant can get up to 18 months of rental assistance, and that goes back to April 2020. So now clients are coming to us having exhausted or nearly exhausted those 18 months. So trying to encourage tenants to seek alternative sources of funding. So that's something we're seeing pretty often, because if a tenant comes to us with a 3-day notice and they've already applied for 18 months, our advice is always communicate to your landlord that you have a pending rental assistance application. But if they've exhausted the 18 months, they're not going to be able to communicate that, and the landlord will be able to, start an eviction lawsuit. I'm trying to think. I can share like one positive story if you all want to hear. basically we had a very young tenant come to us, 22 years old. Maybe it would be better if he's 18, but 22 years old. By the time he reached out to us about his pending eviction lawsuit, a default judgment had already been entered against him. And that meant that he failed to respond to the lawsuit within 5 days of being served. During that time, once we started uncovering the facts and, questioning why he didn't respond to the lawsuit, it turns out that he, had COVID and was directed to quarantine and was unable to go to court and file an answer. So in that time, we also helped him with his rental assistance application, got in touch with the case manager that was assigned to the rental assistance application. So at this point, the landlord's attorney has agreed to set aside the default judgment. We're working together, and he's secure in his home and has applied for rental assistance to cover through March of this year. So he should be safe and secure from eviction. So that was a nice outcome in that case, because he came to us pretty desperate. He was days away from having a sheriff post a notice to vacate on his door, and he would have been locked out in 5 days. So it would have been great if he came to us before the default judgment was entered, but he did catch us in time, and we were able to, file motions to stop the process. So that was a recent, good outcome that we were able to assist with. But I'm happy to answer any questions or talk about anything else that you all are curious about. So.
Just wanted to add one thing to that, Rachel, too, is that, this program takes an all hands on deck approach. It's a collaboration among the attorneys, but really Rachel is doing whatever it takes to keep people in their homes, which is really one of the goals, the main goal of this project.
I'll go around and ask the commissioners if they have any questions or comments. I'd like to start with Commissioner Borelli.
Thank you. I'll be brief. I have a dog. I know how it goes. Just a quick clarification. On the report, it says this program was initiated in July 2020. And at the end of the report, it says, as of January 24th, we've served 203 new unduplicated. So is that 18-month period, roughly, that we've served 203?
Correct. 204 as of Monday, new unduplicated clients.
Awesome. Keep up the great work. Thank you very much.
Commissioner Byers.
Yeah, thank you so much for the report. I just have a question in terms of how to help people manage expectations, because it sounds like you all are very busy and you're doing really great work. And I'm sure you get many calls. If someone's reaching out to you, what does typical response time look like? If they're anxious and trying to, navigate their situation, how much time do they typically expect to receive a call and start to get an understanding of what resources might be available to them?
Yeah, I don't want to overpromise, but we do get back to people pretty quickly. We now have we have Yael Pineda, who's a paralegal who's dedicated to the West Hollywood project, and she is amazing, and she gets back to people really, really fast. So I don't want to give like a number of hours because manage expectations, but we are getting back to people quickly.
I appreciate that. Thank you so much.
Commissioner Freiberg.
Can you come back to me?
Sure. Commissioner Darvish.
Just great job, Rachel. Sorry about making your dark wait, but I'm a landlord myself. I can't imagine doing that to a tenant without going through the city or helping them to use the resources. But is there a requirement that landlords have to? I thought it was a requirement that landlords would have to go to the city hall and do an application, or do they file, or
an application for
before serving that sort of the tenant?
Well, I know under the West Hollywood RSO, a landlord is required to file a copy of the notice as well as a copy of the summons and complaint with the city within 5 days of serving it on the tenant. Under the current protections, a landlord is required, if a tenant hasn't paid the rent for, let's say, January 2022, before filing an eviction, the landlord themselves have to apply for rental assistance through Housing is Key.
Yeah, I was thinking that it should be the process so that the landlord is in communication with City Hall, so it's flagged before the tenant. Most of the tenants don't know about the details of what the protections are. So I'm glad to hear that.
Oh, I would support that, definitely.
Commissioner Davis?
No questions, just good report. Thank you for the work. Excellent.
Thank you. Thank you.
Vice Chair Meltzer?
Thank you. Thank you, Rachel, very much. I have no questions.
I'll come back to Commissioner Freiberg.
I just had a quick question. Do you advertise or how do people find you?
So I know we're on the West Hollywood website. Last year we were advertising. We had a grant with an organization that helps people get the word out. I actually don't know the stats of that, though I should.
It's okay.
Derek,
You can come back to me on this. It's fine.
There's a couple of things. So,
Yeah.
of course, among all of the providers that we contract with, we promote this program for their clients. So many of our APLA, the Alliance for Housing and Healing, JFS, they have all referred clients to this program. But and Rachel, maybe you could clarify this a little bit, is at the beginning of this program, the state housed LA number would go to BetSetic if it was a West Side, location, and if they called from West Hollywood, they would be directed to this program. I don't know if that's still the case, Rachel, but at the very beginning, we were getting clients that way. So they saw the major kind of advertising about State Housed LA and this number to call to get legal advice, and they would be routed over to West Hollywood if they were a resident of the city. Are you still getting clients that way, Rachel?
I think we are. I'm almost positive we are. We're also, just so everyone is aware, in the process of changing our website to make it more accessible to people. So that will be very helpful. And then we get a lot of referrals from the city. They call over to Anwar or someone else working at the city, and they're referred to us. So a big chunk of our calls are actually referred from the city for tenants who are seeking legal assistance.
So, Rachel, sorry to go back to my question. Are you all still sending the mail out, the newsletter to tenants and landlords? Because I used to get, so I had to register new tenants every time. So the city would send them newsletters that would indicate anything about the eviction process or to answer Commissioner Freiberg's question. That was a great tool. I would see it as a landlord, that the tenant would see it directly from the city. Is that still a process?
That's the rent stabilization newsletter, I believe you're referring to, Commissioner Darvis. And yes, we've included BetSetic information in that. And then in the latest recreation guide too, we had information about BetSetic that went to every resident.
Great. I have
another question.
I'm sorry, Commissioner Freiberg, I didn't mean to cut you off.
It's okay. Are you finding that landlords are targeting certain people? Like, let's say somebody who has been living in the building for 50 years, they pay literally like $50 a month for rent. So they're just trying to get rid of them. Are you finding any of that? Like they're targeting maybe a certain area in town or anything?
Yeah, so I'm sure Commissioner Darvis, you're a wonderful landlord, so none of this is directed at
No, I'm just kidding.
That was a trend, that we've been seeing for a long time, even, I'm sure pre-pandemic, that in West Hollywood, the rent stabilization ordinance is really strong. And, these long-term tenants are protected. And yeah, we see a lot of the evictions are against long-standing tenants. So not really a particular area, I don't think, but just tenants who have been there a long time. Like we just got an inquiry from someone who's been there 30 years, like long-term tenants who now the landlords can charge, 5 times the rent. So
yeah.
So would you say maybe seniors? Would it be safe to say maybe seniors are more of a target, or nobody's a target? It's just
seniors, just because it's more likely that they've been living there for an extended period of time. But
they might not have the income also.
Yeah, a lot of our senior clients are, on a fixed income. So yeah, I would agree that senior tenants are, just because those are the people that happen to be living there such a long time and their rent is low.
Yeah. And one more question regarding immigration status. Has that played a part at all? Have people been maybe not using your service and running in the other direction once you started asking questions? Because I know when I worked, in government, as soon as, someone who had kind of an immigration status that wasn't solid, they didn't want to talk to anybody. Have you come across that problem?
I haven't in the West Hollywood project, but some of my colleagues who work in other jurisdictions around the county, I've heard that from them. But personally, I have not seen that in the city of West Hollywood. And then just to piggyback on your last question about, perhaps landlords aren't filing eviction lawsuits against, we do see eviction lawsuits against long-term tenancies, but another way that, landlords are acting is perhaps like a constructive eviction, like not making repairs in hopes of a person moving out because the place is uninhabitable. So not just evictions, but like not responding to repair requests and things like that.
Okay. Well, thank you, Rachel. I mean, your services are just unbelievable. You save so many people, and we're just so grateful that we have you. So thank you.
And thank you so much for saying that. The last thing I'll say is that we help clients no matter what their immigration status is, and we have staff members that are fluent in Spanish and Russian to assist everyone in West Hollywood.
Thank you.
So Rachel, that won't be the last thing you say because I have to ask you a few questions.
Oh, no, go on.
So they're very simple questions, I believe. So you did
Don't
mention
forget about
What? Okay. Can you hear me?
Never mind.
You brought up March of 2022. That is the last date of the protection of, I want to make sure I understand this. If you don't have your rent paid for any amount of months by March of 22, if you have not applied to one of the, like Housing is Key or one of the programs, you can be evicted for non-payment of rent?
So West Hollywood, I assume, though I haven't spoken to, Derek or Jonathan about Jonathan Holub about this, or David, is West Hollywood going to adopt the county ordinance? Was this mentioned at the meeting last night that I wasn't able to attend?
It did not come up at last night's meeting, so we're looking for that direction from council.
Okay. So there are protections that have been implemented starting April 1st regarding non-payment of rent. I guess this is unless West Hollywood does its own ordinance, or perhaps the state does something different. But as of last week, or maybe it was the week before, I think it was last week, the county extended their ordinance and they implemented new protections to start April 1st as it relates to non-payment of rent. Okay. So my understanding, and somebody can correct me if I'm wrong, but I read it, and it's basically, people will continue to be protected if they've suffered a loss of income due to COVID and are unable to pay their rent in April and May. And then people who are, I believe, at 80% of the AMI and are unable to pay their rent due to COVID will be protected through the end of the year. There are notifications that they have to notify their landlord that they're unable to pay the rent, I believe within 7 days of the rent being due. But those protections will start April 1st for the county.
Okay. It's a little confusing, but I think I wrote it down correctly.
I'm happy to come back and explain it more. I guess once West Hollywood decides.
It's a lot of legalese, a lot of law. So you mentioned one scenario, and I want to be clear on what the outcome would be. If someone does apply for that, or the landlord applies for, I'm thinking Housing is Key, but I know we have other providers, and they are denied. What happens at that point? What if it does come back denied and their rent will not receive rental assistance? What happens at that point?
So the tenant is denied?
Yes, or the landlord.
Okay, so
for that tenant.
If the tenant is denied, they will not have that defense. They will not have, they won't be able to, because basically there's a law that says if the tenant is granted the rental assistance for the month demanded in the case, then the case is to be dismissed if they're awarded the money. If they're not awarded the money, They just don't have that outlet as a way of success in the case. I don't want to use too many legalese, so I can explain it a different way, but they still do have other potential defenses as every tenant does in an eviction lawsuit. They just wouldn't have that one like safety net, which would prevent them from losing their tenancy, if that makes sense.
Yes, and would there be a time frame that they would be notified that they would have to pay their rent? Would they get 5 days, 10 days, or no days?
No, my understanding is if they get a 3-day notice and they don't pay it within the 3 days and then they're denied rental assistance, I don't believe they're given an opportunity to, at that point, pay the rent, unfortunately.
Okay.
Because a lot of tenants have asked us that question.
Yeah.
Oh, yeah.
Yeah. And then you had said if someone does exhaust 18 months of assistance, that you send them to alternative sources. And would you be able to just let us know one or two of those sources?
Well, I was hoping, I meant to reach out to NCJW, but Rachel was on earlier and I should have interrupted and asked. But yeah, we refer people to NCJW and Alliance for Housing and Healing.
Okay.
Yeah.
So those are our two, and I knew those. I just didn't know if you had some other resources that you wanted to mention. Well, listen, thank you so much for this, and I know it's complicated, but I think you made it as easy to understand as possible, and I appreciate everything that you do.
Thank you, and I'm happy to come back and explain it. And once West Hollywood determines what they're going to do, I'm eager to see. So, yeah, that's it. Thank you so much.
Thanks, Rachel.
Okay.
Okay, I think next up, on-call transportation program update. I believe it's going directly to Francisco. I think oh, there he is.
Before we start, Chair Palmieri, if I could just give a little point of information. So we will be taking a recommendation to extend the eviction prevention and defense program to council at their March 21st meeting. We've been doing this 6 months at a time. So this current contract is over at the end of March. We'll go March 21st, just to give you a heads up, along with an update on our rental assistance programs and also a recommendation to extend the CES contract. So just want to give you a heads up if you would like to attend that council meeting and voice your support.
David, can I ask you a question on that?
Yeah.
So you would begin it in March, and then you would go through September if these are 6-month increments?
Right. It would start April 1st and go through September.
Great. Thanks so much.
Sorry, because I wanted to make sure I was correct. I texted Jonathan Holland if he's looking at his phone to find out. I don't believe it came up last night, but he did have an item on the agenda. So if that came up and if we're already received the direction that we're following the county with the extension, I'll let you know. Oh, hold on.
Uh-oh.
You already responded. That's a dedicated employee. So the county protections are in place now, but on April 1st, tenants will again be protected from non-payment due to COVID-related reasons. That applies to any tenant through May 31st, from June 1st through December 31st. The non-payment protection is only available to tenants at or below 80% of AMI.
That's county, not West Hollywood?
That's county.
All right, and then West Hollywood you'll let us know once it goes to council.
Yes.
Okay, sounds great. All right, I think Francisco's here.
Good evening, commissioners. So my name is Francisco Gomez, Transit Program Administrator, and today I'm here to provide an update on the city's on-call transportation program. So give me 1 second, I'll pull up my slides. Alrighty, so as many of you know, the city's on-call transportation program is administered by Ambiance Transportation. They provide trips 24/7 using Uber and Lyft as a primary source. However, they also do have their own vehicle fleets available to any participant who is uncomfortable with using Uber and Lyft, or who cannot use Uber and Lyft because they use a wheelchair, for example. To be eligible for this program, participants must live in the city of West Hollywood and be over the age of 62 or disabled of any age. Once on the program, participants are able to purchase up to $100 in fare credits each month. They are purchased in increments of 50, and each increment costs $8. So if someone pays $8, they get $50 in credits. If they pay $16, they get $100 in credits. As I mentioned earlier, the service is available 24/7 and can be used to go anywhere within 10 miles of the city's borders. Next, I'll quickly go over a few performance metrics for this program, focusing on trips, cost, and complaint information. So this chart kind of shows the number of trips provided by the program since it launched in January of 2019 through November of 2021, which is the most current data we have available. So as you can see, in January 2019, the program provided a little over 1,000 trips. For the most part, the number of trips provided increased month to month, peaking in December of 2019 with 2,700 trips or so. Due to the pandemic, we did begin to see a pretty drastic decline in the number of trips provided, reaching a low in April of 2020 with a little over 1,000 trips. As COVID restrictions eased, we did again see a rise in the number of trips provided, plateauing at around 1,800 trips between July of 2020 through the end of 2020. Early in 2021, there was a slight decrease. I think that the rise in COVID-19 cases at that time could kind of explain why that took place. However, as the vaccine rollout as the vaccines were rolled out, I think we again began to see an increase in rides provided by the program. In November of 2021, there was a total of 2,600 trips provided, which is about 99% of the peak we saw in December of 2019. In fiscal year 2021, which is a period between July 2020 through the end of June 2021, the city spent $420,837 on this program, provided 21,626 trips. If we divide the cost by the number of trips, we arrive at an average cost per trip of $19.46. And this cost includes both the reimbursement to the vendor for providing the ride, as well as administrative costs associated with the service. The average trip in this program in 2021 was about 3.6 miles, lasted about 20 minutes, and had a cost of $13.29. This is the amount we would pay Lyft and Uber for providing the actual trip. So no admin costs in this particular figure. As for complaints, this chart just shows the number of complaints that the city received between January of 2019 and November of 2021. When the program was first launched, we did have a high number of complaints, mostly from people who were used to using the taxi program and who were unhappy with the transition. I think as people learned about the new program, those complaints decreased. In the summer of 2020, we did see a spike in complaints. Those were mostly due to people complaining about wait times with having a ride matched to a driver. During that summer, Uber and Lyft saw a decrease in the number of drivers available. So people who pre-pandemic were matched to a driver in about 5 minutes were waiting closer to 15 at times during that summer. Driver availability kind of improved towards the end of 2020, and those complaints decreased. However, in the summer of 2021, we saw another increase in complaints, and those were due to a tech outage that affected the program. Prior to this outage, people had the ability to book trips on their own using a mobile application. And with the outage, the app users had to call in to request a trip. And that was kind of an issue that took a while to address, but has been addressed, and those complaints are once again decreasing. This program has been active throughout the COVID-19 pandemic. And in response to the pandemic, the city chose to provide free transportation to members of this program to COVID-19 test and vaccine sites. So to participate, a participant had to be enrolled in the program and just submit a request to Ambiance once a vaccine appointment, or it wasn't an appointment to a vaccine test site, or once an appointment to a COVID-19 test site or a vaccine site was scheduled. And I think to date, we had about over, I think 100 or between 65 and 80 participants participate in this type of, in the free transportation to either a COVID-19 vaccine or test site. That said, that concludes my presentation. I'm happy to answer any questions the commission may have.
Thank you very much, Francisco. I'll go around the commissioners, and if you have any questions or comments for Francisco, please feel free. Let's see, Commissioner Darvish.
I just have a quick question about how the residents that use the service, how do they qualify, and what sort of, if any, what kind of sort of, financial needs assessment or background is done by the city?
Yeah, so to apply for this program, a participant completes an application and submits proof of residency and proof of age if they're applying as a senior. If they're applying as someone who's disabled, they provide proof of residency as well as proof of disability. And there is no, it's not a program for low-income residents, so anyone can apply regardless of income, as long as they're over 62 or disabled.
Commissioner Byers.
Can you come back to me, please?
Sure.
Thank you.
Commissioner Borelli.
Sir, yes, sir. That's what you told me to call you, right? So in reading the report, there was the outage between July and November. That's 5 months. It seems quite excessive. Could you give us even a couple bullet points on what that was about and why it took so long?
Yeah, so it did take a while, and part of the reason was working with, so the old app used an API that connected directly to Lyft. Lyft changed something on their end that made the existing app not function. So the vendor had to work with, our vendor had to work with our technology vendor to create a brand new app that was compatible. And it took months to kind of get something that was functioning the way we wanted it to work. So it was just trial and error and working with the vendor to get something that functioned.
Were there additional costs to the city for that, Francisco?
No, none of that was passed on to us. So if there were costs, our vendor covered it.
Got it. Okay, thank you very much.
Sure.
Commissioner Freiberg.
I don't have any questions, but thank you, Francisco, for your presentation.
Thank you.
Commissioner Davis.
I second Commissioner Freiberg.
Vice Chair Meltzer.
Thank you, Francisco. I have one question. It's for older adults over the age of, I think what you said, 62. And is it disabled persons 18 and over? You said all disabled, or is it 18 and over, which it usually is?
We don't
here. You don't?
Yeah, we don't limit we don't limit age. So anyone who is disabled, so disabled of any age really. But I do think for just in who participates, I don't think we have any disabled minors participating on the program currently.
Okay, as an older adult, I thank you very much for the program and for your presentation.
Thank you.
Commissioner Byers.
Thank you. I really appreciate the presentation. I'm curious because this it's an intermediary service used to help connect residents to Lyft and Uber. It sounds like there hasn't been complaints on that service, but I've sort of wondered about the drop off, getting to the door from the car. Are there gaps that the drivers from Lyft and Uber who maybe aren't aware that or maybe I'm making an assumption that they are less aware of the people they're actually getting connected to? How does that sort of connectivity work? And maybe is there an awareness that you can speak to that I'm just sort of making an assumption of?
I think for people who do require that extra level of service, we encourage those users to book trips through the program and request an ambiance fulfilled ride, where there's an attendant and a driver who can kind of provide that extra service. We also have a program at the city that's operated through one of our other vendors called a Dial-A-Ride. So this program is free of charge and operates within the city of West Hollywood and Beverly Hills. And so this program provides a higher level of service for people who are more frail. So that's kind of what we have available for people who need more service.
Thank you for providing the distinction. That's all.
Sure.
Thank you, Francisco. It's great to see you. So under normal circumstances, it's $100 in credits per month. I did read in the report, and I think also somewhere online, that if a person has multiple doctor appointments and requires more than 100, they can purchase $200 worth. Can you explain how that works and what substantiation is needed?
Yeah, so that's the enhanced version of the program. So that's available to anyone who's eligible for the program and has frequent long distance medical trips. So we just asked, the program asks that anyone applying for this enhanced program provide just proof of, so there's a form that needs to be completed either by a doctor or by a social worker that just certifies that the person applying in fact does have frequent long distance medical trips.
Great. Anyone else? Great. Thank you so much for your report.
Yeah, no problem.
For answering all the questions. Okay, we'll move on. Excluded consent, nothing. We will go to number 6, items from staff. David?
I think both myself and then Jenny have some items. I wanted to, I've had more communication with Jonathan. I just wanted to be very clear. Jonathan Hollop, the rent stabilization manager. As I mentioned, the county protections, so this is the eviction moratoria, the county protections are in place now, but on April 1st, tenants will again be protected from non-payment due to COVID related reasons. We fall under the county, so those protections are for West Hollywood as well. So that applies to any tenant through May 31st. So those protections will start or renew on April 1st and go through May 31st. The non-payment, from June 1st, starting June 1st through December 31st, the non-payment protection will only be available for tenants at or below 80% of AMI. So right now, it's for anyone who's been impacted by COVID-19. So just to give that clarification, and then when I texted him and said, so we're falling under the county. He said, yes, we're covered in the county protection unless council adopts something providing even greater protections. So they can, offer even more, but those protections will be in place for West Hollywood community members. So hopefully that offers some clarification.
So David, what you're requesting is enhanced, is greater protections.
So we're not requesting that. He just wanted to assure the commission West Hollywood falls under the county protections, which will continue as they are currently through May 31st. Starting June 1st, it will only apply for folks who are 80% of AMI. The council always has the option to adopt greater protections than what the county has recommended or has provided.
So I just want to be clear, because did you say that you were going to be requesting till September?
No. So, okay. So yes. So what we're taking, sorry about that. What we are taking is an extension, the contract amendment for Beth Sedek's Eviction Prevention Defense Program, the program that Rachel spoke of tonight. And along with that, rent stabilization is also taking an extension of the CES contract. But those both expire the end of March. We are taking a contract amendment to council to extend those through September 30th. So for the rest of this contract, social services contract year.
Okay, I misunderstood you.
No, and is it clear now?
Mm-hmm.
Great. So and then real quickly, Derek or Rachel mentioned, I just wanted to give you a very brief update on the programming that's been provided in response to COVID-19. As was mentioned by either Rachel or Derek, the Eviction Prevention and Defense Program has, sorry, it was right here. They have assisted 204 community members and they have resolved 141 cases. And that was since the program was brought on in July of 2020. The two rental assistance programs, one through the Alliance of Housing and Healing, the other through NCJW, these are the eviction prevention, or excuse me, the COVID-19 programs, have provided a total of 2,252 rental assistance grants for a total of $1,597,404 to date. So I just wanted to give you an update on that, and then I'll turn it over to Ginny.
Hi, everyone. This is Jenny. I wanted to provide the commission about my research. I've heard Commissioner Freiberg about N95 masks and the cost and all that jazz. I've reached out to 6 different vendors, and I requested a quote from them for $36,500 for N95 masks. The quotes came back. I have 7 quotes. They came back for anywhere from 20,000 up to 87,000 for the amount, which does not include shipping or taxes. Some of the N95 masks are packaged 20 per box, so it wouldn't be logical to open the box and separate them into 1 mask per resident. Some are packaged 5 per package, but you're looking at anywhere from minimum 20,000 to about 90,000 if you wanted to provide 1 mask per resident. Just something to think about. If you have any questions, I could show you my quotes, but it's been very educating. So thank you.
Okay, so I need to talk about this for 1 second. We cannot discuss this. It's not on the agenda. But what I would like to do is to get we can't take a roll call vote either. So by raising your hand, can I see if who wants to have this on a future agenda? And the agenda would be well after the RFP process. So if you would raise your hand if you want this to be on our agenda, I'd be happy. And if you don't, leave your hand down. Anyone? Okay, so by consensus, it doesn't seem like it would be on a future agenda. David, that was all legal, correct? I did it legally.
Correct. We needed to hear if there was a consensus of commissioners to bring it back, and there was not.
Okay, thank you. Now it is public comment anymore. Jenny?
At this moment, we don't have anyone signed up through me. If anybody in the room would like to make a public comment, please use your hand, raise your hand feature, and we'll call you up. Is there anyone in the room that would like to make a comment? Please let us know now. Thank you.
I would just like to say, I see Yola trying to connect to audio. Is she having difficulty?
I emailed Yola directly. She said at this time she was not making a public comment.
Okay, thank you. Thank you very much. So can we have items from commissioners? I'll go around and let me know if you have anything you want to say. I'll start with Commissioner Davis.
I was just thinking like, oh, please pass me, please pass me.
Do you want me to come back to you? I'm happy.
No. I would like to report that I went to a senior advisory board meeting, the last one for this month, and they picked out the topics that they're going to bring to us and the person who's going to bring them. And it was otherwise kind of an interesting meeting. So, but I will try to go more often. And that's it. Personally, everything's fine.
Thank you. Commissioner Freiberg.
Yeah, I just wanted to make a comment about the mask. I think one of the reasons I didn't raise my hand is, and I want to thank you, Jenny, for going through all of that, that because of the federal response and that mask will be available, more than one, I think up to 3 per household. I think it kind of covers it, and that it's through CVS that I think a lot of people will be able to get them, you know, at their leisure to their home. My only concern, of course, is always going to be people who fall through the cracks, who really need them. But that's probably something that we can monitor. The other thing I wanted to ask David about was, I mentioned this a while ago about evictions when we had I'm sorry, I forget the person's name that came in, presented to us, that the city does get alerts when somebody's evicted, like it goes through the process. So I was wondering what we would need to do to get that safety net, to get them to bet to Zach, to make sure that, you know, maybe they can be saved and they don't need to be evicted. I mean, there's nothing really worse that can happen to these people, well, you know, on certain levels, than losing their home. And if we could stop even 5 people, you know, from losing the place where they live, you know, it's obviously worth it. But I think a safety net for something like that is invaluable. And the other thing, congratulations on the West Hollywood Park. It's amazing. Like, as soon as they took down those you know, walls, it was like, wow, you know, it was really impressive. I think my only concern is, I know people aren't supposed to smoke in the park. They're not supposed to smoke cigarettes, cannabis, whatever. There was a group of people smoking cannabis. I mean, you couldn't even go near that end of the park. I was out immediately. Is there anybody monitoring the park? Like, who would you tell? Because there was literally a sheriff maybe 50 feet away who completely ignored the entire situation. And it was very obvious what was going on. So is there somebody that actually monitors the park? Like, who would you tell if you were in the park and you had an issue?
So
David?
it's a combination, and I also wanted to comment, Commissioner Freiberg, on your first point. So it was, I believe it was Jonathan Hollab who came in, he presented a while back, who is the rent stabilization manager and who I've been texting. And you're correct. So landlords are supposed to file a notice of eviction with the city. As Rachel Levy mentioned, they have 5 days to do that after they've actually, you know, provided that notice to the tenant, which is a little, you know, time is flying. But I will definitely follow up with Jonathan. And is there any, you know, can those notices be provided to Bethesda? Is there any kind of, you know, confidentiality or? But anyway, I heard that, and I'll follow up with Jonathan. The park staff does, you know, they do monitor. You know, if situations come up that, you know, that they can't handle, they're going to call the sheriffs. We also do look to block by block, who also do shifts at the park. So it's a kind of a combination effort, but a lot of it does fall on recreation staff, park staff.
Okay. I just pulled up a website for smoking ordinance, and there's a phone number and an email where individuals make complaints to, which is code compliance.
Thank you, Jenny.
And I'll provide that via email for everyone.
And that is it for me. Thank you.
Thank you, Jenny. Commissioner Darvish, did you speak already? I'm sorry, I got confused when my screen went blank.
I haven't yet, but thank you. I'll go quickly. I wanted to recognize the February month for Black History Month and celebration for Black History, and also the self-check month for all of us to remember to check in with ourselves. You know, I know the pandemic has had a lot of effects on all of us, isolating and you know, you may not recognize or think about, you know, what you yourself are going through, but a lot of concerns, you know, about COVID and all that went on, being separated from family and friends and all of that. So just wanted to remind all of us to do that. And happy Valentine's Day to all of you. I wanted to also bring up, well, that thing was Patrick that brought up from Disability Committee, the chairperson, about what we may want to do and focus that we should have. You know, we talked about older adults and what accommodations we may have more things for them in our city to improve quality of life. You know, mini parks, we don't really have enough mini parks. I see older adults in daycare center, adult care centers that are being walked by the sort of nurse assistant or the aides that help them to get out and walk on the streets, and the construction site, traffic going by, really scary situations, a lot of noise. You know, you go to most cities like New York or larger cities, they do have those mini parks that you know, people could enjoy, everyone, but including older adults and disabled populations too. They can't get too far, and some of them may even be cared for at those facilities. So I think we should really focus more on that, and you sort of approach it in that way of how do we make life better for that population. So I wanted to thank Patrick for joining and reminding all of us about that. So thank you.
Thank you, Commissioner Darvish. Is there anyone that wants to speak? Because I have to be very honest, when the screen changes, I get all confused, and now I'm not in my order again. So who has not spoken? Commissioner Byers?
Thank you, Chair Palmieri. I want to just first welcome Sam Borelli, Commissioner Borelli, to this commission. I'm so glad to get to work with you. I know you're a legend here, but I've never sat with you on this commission, so this is very exciting for me personally. I want to thank Commissioner Freiberg. When I saw a slew of emails in the last couple of weeks talking about the N95 masks coming to our mailboxes, seeing a bunch of national orgs champion them, it just really gave me a pause, and just wanted to say a public moment of appreciation for how much you've been pushing for that and really raising that attention here. Because if the federal government wasn't prepared to do it, then we were in a good position to consider being able to do that. And that was because of your advocacy. And I really appreciate you doing that. And thank you, Jenny, for all your research. I also want to just celebrate the park being open. It was just such a cool thing. I didn't realize that the gates had come down until I was walking next to it and was just so used to not seeing it open, and then pivoted and just literally started running and skipping through the park. So I hope everybody gets a chance to do so if you haven't already. And then the last thing I want to say is just a plug for the homelessness count. I know our city isn't necessarily participating in the same way that our neighboring communities are, but our neighboring communities are inviting people to participate by volunteering on those 3 nights. And that got moved from last month to this month, and it's happening in just 2 weeks. So I believe the website is theycountwillyou.org. And I just want to encourage people to considering signing up and participating in the LA Homeless Services Authority's count. Especially just to participate in the work of the broader region's work around ending homelessness. I think it's really important. And if you haven't participated in that, it's a really good opportunity to see the work that service providers do on the ground in that small moment of time. So thank you very much.
Thank you, Commissioner Byers. Commissioner Borelli, did you speak already?
No. And if I did, I'd say no as well. That's just legend.
Just in my brain.
I've had 2 questions for staff. If they can, if not, I'm happy to get an email at another time. Because during public comments, we heard from Diane and, oh gosh, I forget her name now, about the guaranteed, Rachel, how could I forget? About the guaranteed income. The first question I have is, if my day job, somebody's living in an affordable rental apartment and they qualify for that because of their income, how does, if they then win the lottery and get one of these guaranteed incomes, does that affect their ability to continue with their affordable apartment? Has that been considered? And what might we have to do there?
I'll follow up, Sam, with staff.
Thank you. And then the second question is, I mean, somebody really could apply who's not LGBT and just check a box that says LGBT. I'm not sure what we could do about that, but I just wanted to say that out loud. Thank you to Commissioner Ayers from Rent Stabilization for the shout out. And I'm glad Commissioner Darvish circled back to advisory board member Blood about thinking about our disabled community members. I'm often, as I walk so much early morning, late afternoon, encountering barriers to walking, sometimes with the sidewalks being encumbered by the out dining experiences. I was unpleasantly surprised at even elected officials who took umbrage to my challenges with the bikes and scooters being left and saying, well, just pick it up and move it. well, I have a disability myself with my back and my hip, and I can't just pick it up and move it. And I often think of my friend Yola or my friend Annie with her walker or with her wheelchair. So I'm glad Advisory Board Member Blood just reminded us that this is an everyday thing for a whole lot of our community members. Good point. Appreciate it. And thank you all for welcoming me back so generously. This is, as I said, home, and I appreciate it. And I look forward to the funding cycle. Great meeting being run by our chair, Jimmy Palmieri. Thank you.
Vice Chair Meltzer.
Thank you. Well, my first note was to welcome you back, Sam. I'm so glad you're here. I'm so glad you're here. And also, staff, thank you for the acronyms. Really wonderful and really important. I attended the Children's Roundtable, which I always do, as Leslie knows, and there was a wonderful presentation about children's books and how they may be used to teach adults. And I'm going to figure out how to do that because I think it's really important. I also went to the Homeless Collaboration, and nobody's talked about, is there going to be a report on that and what's happened and what's new in the city? I think that because I got an email about that, I think it's very important information about what is going on. And where did I see that, Jenny?
I probably emailed you something like a press release. I will add it to my follow-up email.
Okay, I think
currently
everybody
working on.
should see that. I do. And the other thing is, I have been very, very interested in ageism. I mean, like fiercely interested in ageism. And so I am now serving on the American Society on Aging, Ageism and Culture Advisory Council. So I want everybody to be really careful here. And I'm very excited about it. And yes, at some point, Commissioner Darvish will be using the words older adults. We'll get rid of senior. Thank you. That's all I have. That's all I have.
Hey, did anyone not speak yet? All right, it's my turn. I just want to express my extreme disappointment in Mayor Meister's choice for replacing Commissioner Sandrick. No, I'm teasing. Sam, I'm so glad you're back. I truly, truly missed you. And I'm glad she made the right decision. And I'm glad that it was you, truly. I did have some conversations about the guaranteed income and what the laws would be. And it does indeed affect other benefits. So they are going to have benefit counselors available should you hit the lottery. And I think there will be 25 folks that will be selected by an outside source, from what I understand, to make it all, of course, legal. And they will sort of, it'll be your decision, but they'll explain what will be maybe taken away or, you know, what would be affected. So I think that's a great question and a good conversation for folks to have. I think board member Blood is still in the room, and I just want to say out loud that I think myself and probably some of my colleagues, if not all of them, always take into consideration folks with disabilities while we're making decisions. I think that disabled folks are in the forefront of our mind, of course. So please don't ever think that this commission is overlooking. We simply are not, and we support assistance in any way. And I think for me, that's it. And it's time to call this a night. So I'd like to end this meeting at 8:03, and I will see you next month. Oh, a crystal fell out. A crystal fell out as I hit it. Look, my gosh. All right, folks, it was really good to see you all.
Good night, everybody.
Good night, everyone.
Take care.
Bye.